So palliative care is specialized medical care for people with serious illness. So we deal with anyone with any serious illness at any stage or at any age, and the goal is to take care of both the patient and their family members. And this can be provided along with curative therapies. So the team members within a palliative care team include a physician, nurses, nurse practitioners, social worker, chaplain, pharmacists, and they're pretty much the core of the team. And the great thing is it's an interdisciplinary team, so you hear different voices, different perspectives, and to bring the best care for people. So I think palliative care is going to be key to providing care for our aging population. From the numerous randomized control trials that have been done, show that palliative care not only improves quality, people actually live longer in many of these studies. But none of these studies have actually shown that people die sooner. So there's great benefit in terms of its equal or much greater survival, number one. Number two is there's greater patient satisfaction, patient and family satisfaction. And third is, in terms of cost, if you look at cost overall, they're either the same or much less. And it can be from anywhere from hundreds of dollars to thousands of dollars per patient. So if you look at the Institute of Health Improvement, their triple aim, palliative care meets the triple aim. And the goal is to actually meet the quadruple aim, and the fourth aim is actually self-care. Because we need to be whole to be able to be present for our patients and their families to provide the best care. And if we don't take care of ourselves, then we can't give our best. So palliative care, again, can start at any age. And sometimes that age could be at 20-week gestation when someone is diagnosed with an illness. And during that time, a palliative care team can work with a mother and the family to get them prepared for the next stage after a baby's birth. And that could be for a long period where the baby is ill, or it can be a short period if they have a very short prognosis, during which time hospice can take over. One of the key components of palliative care is better communication. And what better way to communicate better than have a tool that's at your wrist, where you can actually have a tattoo that sticks on like a kid tattoo that peels off after a week or week and a half. And it's a reminder to say, when you're sitting down with a patient, to say, oh, so what's your understanding of your situation? How do you like to get medical information? And what are you hoping for? What's important to you? And then, have you thought about a time when you could be sicker? I think this is a good reminder for people to communicate better with their patients and the people that they care for, because we need to elicit information from people to find out what their goals are, what are they hoping for, so that we can actually give them personalized care. So when I think of palliative care, I think of providing personalized care based on what people's goals and wishes are. So what happened is palliative care developed out of hospice, and hospice care is for people who are terminally ill, who usually have, here in the U.S., is for people who have a prognosis of 6 months or less. And since palliative care grew out of that, a lot of that that association still sticks. And so quite often some people may still think palliative care is end-of-life care. And it's actually a very small portion of what we do. The bulk of patients that we see are people with any serious illness, from cancer to heart failure to dementia. And some of these patients we actually see from diagnosis. I think the important piece here is to empower doctors, to empower nurses, to empower pharmacists and other healthcare professionals to advocate to patients for palliative care and to make sure that we figure out what their values are so that we can provide them the best care. And and that starts with a conversation to say, you know what, I think you may benefit from palliative care, and here are some of the benefits. So I think there's a big culture shift that needs to happen in healthcare, from doing things to people to actually figuring out what people want and seeing if we can get them to that state. And that takes culture change, and it takes initiatives from the higher ups, from the C-suite of hospitals and health systems. It takes initiatives from leaders in our nations. It takes a lot of groundwork from healthcare professionals. So one thing we know is that we will never have enough palliative care providers, whether they're doctors, nurses, pharmacists, what have you. And so we need every doctor, every medical student, every nurse, every nursing student to have these skills. We need this incorporated into residency programs, no longer as an elective, but a requirement for every resident to go through, because to have many of these things that we learn in residency, we master through doing. And what greater way to master this than training and making this a requirement so that people can be their best selves. And that can be in any residency program you're in, whether you're in internal medicine, surgery, radiology, what have you. I think the one thing that we forget about quite often is we're so busy taking care of people and families, we forget to take care of ourselves. So making sure that self-care is a part of each palliative care program, where we have time for reflection, where we have time for mindfulness exercises, so that we can actually be whole, so that we can actually take care of our patients.